Hey parents, I'm Dr. Rachel, and today I want to talk about one of the most talked about things in infant and pediatric healthcare today, tongue ties. Tongue ties are getting the blame for a lot of different infant and pediatric conditions, which leaves parents with a whole lot of questions on what to do, how to diagnose it, and really where to go with everything. So today in this video, I want to break down tongue ties and I want to break down TOTS, which stands for tethered oral tissues. And I don't want to just look at it from a symptom standpoint where, yeah, they might have a little bit of trouble latching. They may be struggling with nursing. They may have some clicking or they may be getting too much air. But I really want to look at it from the neurodevelopment standpoint, look at the science and look back at some of the things that might be causing it, and then also look at care options for it, whether that be revisions or whether that be something a little bit more conservative. So when we look at tongue ties, or what is commonly referred to as TOTS, they're oftentimes attributed to genetics, right? We're not really quite sure where they come from, and so genetics are blamed. You've maybe heard of the MTHFR gene, things like that, more of a tissue and overdevelopment issue based off of soft tissue and nutrition. Now, while that might be some of the case, what I really want to dig into and look deep into today is the process that controls all of that. And as a pediatric chiropractor who's a doctor of the nervous system, one word really comes to mind, and that is tone, the tone of the body. So ties are soft tissues, and really those soft tissues anywhere within the lips and tongue, but really anywhere within the body. If the tone of the nervous system of mom and baby while baby's growing and developing is stressed and tense and tight, whether that be from emotional stressors or physical stressors, then baby's nervous system is going to grow in a more protective state, and it's really going to affect the growth of all those tissues. There's a lot of research coming out now that shows not only in utero development plays a massive role in the protective state of baby's nervous system, but also the delivery side of it and the stress that comes with that. So in utero, if there was stress, baby's system gets a little bit more wound up. And then if they already have a predisposition to the genetic side, maybe different prenatals and supplements and things like that, then that is all going to work together to cause the ties that we see so commonly now. That begs the question of why do some kids struggle with it more than others? And it seems so simple, but the answer is stress. And not just stress in utero, but also stress during the birth process. And as pediatric chiropractors, that's exactly what we look at. Stress, and also specifically stress during the birth process. And you may be wondering, how does a traumatic birth or stress during birth have anything to do with tongue ties? Well, the answer is anytime there's extra stress placed in this region up here in the upper cervical or the upper neck, whether that be from C-section, manual assistance, forceps, anything like that, that places extra stress in this area, then the muscles, tissues, and bones in this area are going to have altered tone. In fact, they did this study called Incidence of Somatic Dysfunction in Healthy Newborns. So these are newborns with no symptoms. Symptoms like colic, reflux, constipation, things like that. They didn't have any symptoms except for the somatic dysfunction, which is just a fancy word for tension and tightness in that upper neck. So they looked at 100 different babies, and they looked at their ability to rotate their head, bend their neck, suck, swallow, do normal motions that babies should be able to do. And it turns out that 99% of those 100 newborns had some type of motor restriction in that upper neck. Now, why does that matter, and why is that associated with tongue ties? It matters because if there's already a tongue tie there, or any in utero tension comes up, if there's motor restriction with anything else, it's going to essentially aid in that genetic disposition. It's going to accentuate those stressed out tissues, and it's going to make something that was already there a little bit worse because the tone and tension in the body was already altered up here. That's why it matters so much, and that's why we as pediatric chiropractors talk about this so much. Whether they get a revision or therapies or chiropractic care, there's so much more to it than just the genetic component. And as a parent, most of the time you're going to have a decision to make. Do I do a revision or do I not? And that is really such a unique scenario for everyone. That's where I would get a really great pediatric dentist who is an expert at tongue ties. But here's what I do know. Kids with tongue ties, whether they get a revision or not, they will struggle if the tone of the nervous system is not helped, and that's exactly what we do as pediatric chiropractors. We look at the tension that happened in utero and during the birth process, and we help that unwind. And here's the other side of that. For babies with tongue ties, babies that get those tongue ties revised, all of a sudden, all of that tension that built up is suddenly released. And for a baby that's so used to having all of that built up in their neurodevelopment, it's going to be really unstable for them. They're not going to be happy, and it's going to be uncomfortable. So we need to look at all the variables around that tongue tie, make sure they have good movement of the neck, they can suck and swallow through the nervous system, through those motor reflexes, things that are separate from the tongue tie so that they can be the absolute best they can be, even if they have to get that revision. And with tongue ties, you have to have a team. So if you've got a pediatric dentist and another practitioner and they're giving you all sorts of different options on what to do and where to go, maybe add a pediatric chiropractor to that team as well. Because taking away those variables alongside the tongue tie can make such a big difference, because the tone up here is so important, not just for those oral tissues, but for nursing, the regulation of gas, and for baby to grow and develop as best as they can. Now, I know you've got a lot of questions if you've tuned in this far to the video, so we're going to attach a really helpful article that you can dig into to find all the different things that you need. And if you need anything else, please reach out to us, contact us. We'd love to help. We know every single story, every kid is different. Their birth process, the different stressors in their life, everyone is a little bit different, and we just want to help however we can. Thanks for watching, and we'll see you in the next one.